And welcome once again to Wayne's World. I'm Wayne Dawson. My next guest has a very impressive resume. For starters, he's a well-known urologist and kidney transplant surgeon at Metro Health Medical Center, but he is also an author and an advocate founding the annual Minority Men's Health Fair right here in Northeast Ohio. Please welcome Dr. Charles Modlin. Doctor, thank you so much for stopping by.
It's such a great honor to have been invited to be in your presence.
I'm going to be honest with you, man. It's an honor for me to be with you because you've done so much over the years. You really, really have as far as men's health is concerned. But let's expand a bit on your role over at Metro right now.
Sure. So I'm a practicing urologist at Metro Health. I've been there now since September 2021. I've done a lot of work with respect to community outreach. I took the Minority Men's Health Fair that I started at Cleveland Clinic over to Metro. We held it over there for 3 years. And as you know, we started that in 2003 at Cleveland Clinic. Over the course of 22 years, we lost a couple years due to COVID, but over those 20-some years, we've served probably 25,000, 30,000 men. Providing them with free preventative health screenings. We call it the Minority Men's Health Fair, but it was obviously open to everybody. Some women even took advantage of that. But yeah, I'm still seeing patients over there as a urologist at Metro Health.
Talk about the thought process behind that health fair.
Growing up, I grew up in a small town in central Indiana called Newcastle, Indiana. My father always impressed upon me that it was my responsibility to use my education to give back to the community. My father actually had to leave high school when he was in 11th grade to enlist in the United States Navy for World War II, and so he never had an opportunity to finish his education. And he was always, my mother also, she was actually the first black school teacher in the history of Henry County, Indiana. Okay. But both my parents stressed upon me and my siblings the importance of acquiring our education, but not only acquiring our education, but using our education to give back to the community. And I remember as I was growing up, my father would always tell me, I didn't quite understand when I was younger, he would say, nobody cares about black men. And as I had different lived experiences, grew up, I understood what he was, referring to. And I had an epiphany, one day, back in the late 90s. I came to Cleveland in 1993, did my kidney transplant training. I joined the staff at Cleveland Clinic in 1996. But I had an epiphany remembering the admonition of my father to give back to the community, to use my education to benefit the community. It came to me after I had, my family and I visited it's called the National Underground Railroad Freedom Museum in Cincinnati.
In Cincinnati, yeah.
Visiting that museum, it had such a important impact it actually made me angry seeing a lot of the exhibits in there. And it had such an impact, and I remembered what my father had told me. That I had a vision of something, or what could I do as a urologist, black male, to improve the health of the community, to use my education, and that's how I came up on the concept, the vision of developing this Minority Men's Health Fair. At the time, I went to a lot of the leadership of Cleveland Clinic, all the different department chairs, and that's how that came all about. And the first year we had 35 men show up for the health fair.
Just 35 men.
Just 35. But one of the main reasons why that grew up to several thousand individuals per year, it's because of you.
Really? Oh,
it was because of you.
Yeah.
No, it was because of you, because you actually allowed me on your show for 20-some years to raise awareness about the event. I mean, without your help, that would have never really, we would have never been able to reach all those men. So
I'm humbled, man, because I'm telling you, what you are doing is absolutely incredible. Let's talk about that. Yeah. What are some of the things that was offered? Or you didn't do it this past year, but you're going to do it again?
Well, I would hope so, because that was such a unique offering. I mean, one of the reasons why black men in particular, minority males have such a higher incidence of health disparities, lower life expectancy. Black men on average have about an 8-year shorter life expectancy.
What is our life expectancy?
Well, it's really, it depends on what area of the nation that you live in, what your comorbidities are.
The average life expectancy, 72 for men?
Well, it could range anywhere from 67 years old to 71 years old.
That's crazy.
But if you, in contrast to white men, they have a 7-8 year greater or longer life expectancy. But a lot of the reasons why there's a shorter life expectancy, there is some hereditary genetic component. If you have a first-degree relative who's had prostate cancer, your risk as a black man is higher. But a lot of it has to do with what we call the social determinants of health, not having access to health insurance, not being necessarily health literate to know what type of health screenings you should undergo, whether or not you have symptoms or not. Being distrustful of the healthcare system, Tuskegee syphilis experiment, I mean, there are a variety of factors.
Even to date, in 2025, those problems are still out there.
Oh yeah, I mean, and another example is sometimes we'll diagnose, like through CAT scans or MRIs, we'll diagnose somebody who may need a biopsy of their prostate or another organ, and there's still a myth and misconception that many individuals have. I think it's more prevalent in the Black community, that if the doctor puts a needle in to biopsy a particular lesion or mass, then that's going to cause the cancer to spread. So there's a lot of misconception out there. I spent the majority of my career at Cleveland Clinic, 28 years, practicing kidney transplant surgery, and not everybody is aware of the fact that if they can qualify to receive a kidney transplant if they have chronic kidney disease. It's the best form of therapy of chronic kidney disease or chronic kidney failure. Not everybody is aware, and speaking of lack of health literacy, that the best way to get a kidney is from a living donor.
From a living donor.
So there are a lot of things. The onus is really on the health professions and professionals to disseminate the information and distill it out to the community so they have a better understanding how to.
You're an expert in prostate cancer and kidney as well. And let's talk about kidney real briefly before we go back to prostate cancer. A person who receives a kidney.
Yes.
How long does that give them? I mean, what's their continued life like?
So the average recipient, or the average lifespan of what we call a kidney from a deceased individual is about 8 years. But see, that is only the average. I mean, I've seen individuals who have had kidneys going for 30 years or more.
Okay.
So, and again, it depends on the age of the individual, whether they have severe heart disease, diabetes, other comorbidities. But in contrast, the average lifespan of a kidney from a living donor, whether it's living related or living non-related, is about 21 years.
That's beautiful.
So we need to educate the community about the importance of living donation. A lot of people don't know that they can refer themselves to be on a kidney transplant waiting list. They don't
on your license?
Well, that's to be a donor.
Okay.
But if you're somebody who's been told that you have kidney disease, kidney failure, you're on dialysis, a lot of individuals don't know that they can refer themselves to the transplant center. A lot of people may think they have to be referred by their nephrologist, primary care doctor. They can actually be on more than one list also.
Is the waiting list? That's reality for sure.
It's a reality.
What does it depend on, whether or not you're selected to get a kidney?
So it depends on a number of factors. Your comorbidities. I mean, you have to undergo a thorough, comprehensive medical evaluation to determine if you would be able to medically or surgically qualify. I mean, we have to do things like CAT scans to assess the integrity, the patency of your blood vessels, where we have to hook the kidney up to. You have to, in many situations, get your heart checked out, your lungs, be a non-smoker. You have to get screened for different types of cancer, colon cancer, breast cancer, things of that nature. It requires we call it a pre-kidney transplant evaluation. A lot of times it takes a year to get all those evaluations completed. But you also have to demonstrate that you're going to be compliant after you receive the kidney transplant. Because when you receive a kidney transplant, you have to take anti-rejection immunosuppressive medication, which can have some potential side effects. So you have to demonstrate that you're going to take those medications, because the supply of kidneys is short. There's not enough kidneys to go around for people who need kidneys, and so in determining who's going to receive a kidney transplant, we have to make sure they're going to be compliant, follow up with their medical appointments. We look at whether or not they have social support, transportation to and from the kidney transplant center.
When we talk about a match, what does that mean?
So there's different levels of matching. We generally refer to there's proteins on the surface of your cells. We call them antigens. And we try to match you up with those 6 antigens. There's minor antigens as well. There are situations where somebody will actually have what we call a perfect match. It's not really perfect, but we're referring to those 6 antigens on the surface of the cells. And we refer to that because when you receive an organ from another individual, your body will respond because it sees it as foreign tissue, and it will create antibodies to attack those cells on the kidney. So everybody needs anti-rejection medication. Some people need more than others, and you know, that anti-rejection medication lowers your immune system to where you're more susceptible to developing infections and cancer over a period of time. So we have to follow you up very closely. So once you get the kidney, the process is not over.
It's not over.
It's not
not often I can talk to a doctor who's an expert with prostate cancer and all of that, you know, as well as, you know, urology, and which is absolutely incredible. So let's hit on the prostate real quick.
Yes.
Curable if caught early.
Oh, very much so. And the main point is you don't have to have any signs or symptoms. The way that we detect prostate cancer, and one reason a lot of guys shun going to the doctor to get screened for prostate cancer, they always remember there's a lot of talk in the barbershops about getting that finger test, the digital rectal examination. In most situations, we don't even have to do it.
Okay.
Because there's a simple blood test called the PSA. It stands for prostate specific antigen.
And that level should be what?
Well, see, actually it depends on which decade of life you're in. If you're in your 40s, that level should be, and also depends on the race of the individual. Black men develop and die from prostate cancer almost twice as often as white men. So we set what is considered the level at a little bit lower in black men. So if you're in your 40s, that PSA should be probably roughly around 2.5 or less. If you're a black man, if you're in your 50s, probably 3 or less, 60s, 3.5 or less, 70 or above, you know, 4.
And now you're a prostate cancer survivor as well.
Yes.
Cancer. I mean, I've just been dealing with this for the last several years.
Right.
I got the seeds.
The brachytherapy.
Talk about some of the treatments that you have.
Yeah. So there are various curative therapies, and in many situations, so it depends on what grade of there's different severities of prostate cancer. We call it the Gleason scoring system. That's named after a pathologist. So when we do the prostate biopsy, the pathologist looks at the tissue samples from the biopsy under the microscope, and there's different degrees of severity or aggressiveness. So there are many situations where, and the grade goes from 6 to 10, the score. And so if you have a score of 6, that's low grade. And that means that you don't necessarily have to undergo therapy, radiation, or surgery. You can actually undergo what we call watchful waiting or surveillance. And that means getting a repeat biopsy every couple of years, getting, you know, repeat blood draws, PSAs. If you have a higher score of higher severity, then the recommendation generally is to get some type of curative therapy. Sometimes if you have a 7, you can go on surveillance also. But there's various cures for prostate cancer. If we assess that there's no spread to the lymph nodes, you can actually qualify to get surgery. We call it a radical prostatectomy. Nowadays, that's generally performed minimally invasive. Before, we had to make a larger incision and actually put our hands into the wound. But now it's done with the assistance of robotic prostatectomy, minimally invasive. A lot of patients go home within a couple days or the next day after that.
Okay.
There's something called external radiation. That's where you go in for usually about 20, 25 days, Monday through Friday, get external beam radiation. Then there's something called brachytherapy, seeds, pellets. That's a surgical procedure where you're put under anesthesia, and then you have radioactive rods or pellets inserted directly into the prostate. So again, we have a lot of different options to treat individuals.
What would cause you to take out the prostate?
So it's really personal preference. I mean, there are some individuals who may have certain other health concerns, severe heart disease, respiratory, lung disease, bleeding disorders, that they may not qualify to receive surgery versus, another therapy, radiation, for example. So it depends on the overall health of the patient, whether or not they would qualify. But by and large, to answer your question, how would a patient or the physician select surgery versus radiation? It depends. In many situations, it's a choice. It's up to the patient after they're given informed consent. And the reason I say that is because the overall survival, the overall 10-year, 15-year survival in a man treated with radiation versus surgery is equivalent.
Okay.
There are some advantages of having surgery versus radiation. So if you have surgery, removal of the prostate, we follow your PSA at certain time intervals after surgery, and that PSA should go down to nadir, to negligible values. But if we see it start creeping back up after surgery, then that would suggest there might be a recurrence, and then we can give you some radiation on top of the surgery you already had. If you had radiation as your initial therapy and that PSA starts to creep back up, then it would suggest maybe you might have recurrent cancer. We have to rebiopsy the prostate to see if there's active cancer. In that situation, it's very unlikely that we can give additional radiation on top of the radiation you already received.
Let me ask you this, just your opinion. Why are we seeing so many cases of cancer today?
It's hard to understand all of the reasons, and there have been studies and research. You look at black men from the continent of Africa, they actually have a very low incidence of prostate cancer. But then when they matriculate to the United States, once they've lived here for a while, their rate also increases. I think it has something to do with the Western diet, high fat intake of fatty foods, smoking. As I said, there is a hereditary component. If your father, uncle, brother had prostate cancer, your risk goes up also. So we don't know all of the factors that are contributing to the higher incidence of prostate cancer, colorectal cancer.
Do you think they'll ever find a cure, Doc? Do you really think so?
Oh, yeah, I think so. I mean, you know, it's important, and that's a good point that you make. It's important that research continues. And that's another disparity that we see. The black community is more reticent, less likely to want to undergo or participate in clinical research trials.
Okay.
But I can tell you, there are, like in the case of treating high blood pressure, hypertension, there are medications that are more effective, more efficacious in black individuals versus white individuals. In the area of immunosuppressive medications for following organ transplantation, we have to give higher dosages of certain anti-rejection medications in African Americans. It has to do with the fact that African Americans have a higher metabolism rate of certain medications. It's related to the P450 enzyme in the liver. So it gets down to the basic science that we need more research. We need to have more students interested in going to the research fields, also more diversity in the research.
I'm going to stop you right there.
Yes.
We're about halfway through. We're talking medicine with Dr. Modlin, and we're going to also talk about his journey to where he is today as well. We'll be right back. Stay with us. Welcome back to Wayne's World. I am talking with a legend in the medical field, a man who was noted as one of the top black doctors in all of the United States of America, the first African-American transplant surgeon, the first African-American staff urologist at the Cleveland Clinic. The board you're on, absolutely incredible. Talk about, first of all, your time at the clinic, and how did you make your way there?
So like I said, I grew up in Indiana. I received my undergraduate degree in chemistry from Northwestern in Evanston, Illinois, and I stayed there, attended the Feinberg School of Medicine at Northwestern University. Then I matched in urology. I went to New York University in New York City I did a 6-year internship and residency at NYU in urology. Then I found my way to Cleveland Clinic. From 93 to 96, I did a 3-year kidney transplant fellowship. So, kidney transplantation is just a subspecialty of urology. Okay. Nowadays, it's mainly conducted under the Department of General Surgery. There's very few urologists. Cleveland Clinic is one of the few places remaining in the entire nation where urologists do perform kidney transplantation surgery.
Interesting.
Yeah, but I was only supposed to be here for 2 years. I was going to go back to New York, but we loved it here. I did a extra year of fellowship and training. I was asked to stay on, and I joined the staff of the clinic in '96.
You said we loved it here. Talk about your family.
So my wife is actually an anesthesiologist over at Cleveland Clinic. She actually spent, I think, 27 years at university hospitals, Rainbow, practicing pediatric anesthesia, and then probably about 5 years ago she moved over to Cleveland Clinic. She practices mainly in the regional Cleveland Clinic hospitals. She takes care of both adults and children nowadays. Okay. Then I have 4 kids. My son, Trey, he's Charles III. He's actually news director at WOVU 95.9 FM radio.
Are
Yeah.
you serious?
Yeah, news director.
Oh my gosh.
Yeah, he's got a sports talk show.
Oh, good for you.
Every Saturday from noon to 1.
Okay,
It's called
okay.
Tactical Sports Talk with Trey Modlin. He spends the whole week preparing for that. He
Does he?
talks a lot of analytics. He knows everything about the Browns, the Cavs, the Guardians. I mean, he has, every once in a while he has some people, you know, he interviews some people, but it's mainly him giving his synopsis of.
What time? Is that on? What time does it come on?
So every Saturday noon to 1.
I'm going to have to check it out.
And there's a free downloadable app also, WOBU 95.9 FM. It streams live on iHeart.
Okay.
He actually spent a couple years at iHeart, also as producer, but then he went back to WOBU.
Okay.
Gives him an opportunity. He actually produces all the public service announcements and everything.
Oh my.
My oldest daughter, Sarah, she lives in Morgantown, West Virginia. She's a epidemiologist, biostatistician, University of West Virginia. Then I have a daughter, Hannah. She completed her chemical engineering degree about a year ago at Cleveland State. Now she's back doing a biomedical engineering degree. She has to merge those two.
Let me ask you, did you have your last child?
Then my last one is
Yeah.
Elaine Modlin. She actually works at Sherwin-Williams as a computer programmer, JavaScript. Yeah.
Okay, they're all doing very well.
Doing very well. Yeah.
And,
All smarter than me. So.
well, I don't know about that. I was just going to ask you, were you always the smartest guy in the class growing up?
Well, I mean, I always did well. I was always at the top of my class in science and stuff. I remember in high school I had to make a decision whether to go into music or medicine.
Okay.
I used to be all-state trumpet player. I'm
okay.
horrible now. I play in the Shaker Community Band. I'm the last chair, you know, so I kick myself. I should have practiced more, you know, when I was the last 30 years, but I didn't have time. But
You didn't have the time. Yeah.
But no, we enjoy, you know, living in the community, going to Blossom, Cleveland Orchestra, things like that.
Yeah, you're here to stay now. You're a Clevelander now.
Oh, yes.
Your years at the clinic, how rewarding were those years for you?
Oh, very much so. I mean, it had its challenges. I mean, taking care of some very complex patients. You know, as a kidney transplant surgeon, I also had a urology practice as well. But I actually enjoyed it. I appreciated having the opportunity to serve that long at Cleveland Clinic. And, you know, I started the Minor Men's Health Fair, and again, I give credit to the leadership of Cleveland Clinic for allowing me to do that. They gave a lot of in-kind support for us to be able to do that. We had 650 volunteers from Cleveland Clinic.
What are you most proud of?
You know, you mean being at the clinic?
Just in general.
In general? I would say I'm most proud of my children. You know, my job here is to help facilitate their success. I mean, not that they need me anymore, you know. But I'm proud of my parents also for the lessons they taught me. I would say my children, but also my parents. You know, they taught me to have a strong work ethic. I remember my father put me to work. I remember you know, the story, I was on the 7th grade basketball team, and I decided not to go out, you know, to try out for the 8th grade team. My father found out. He goes, well, if you're not going to play on the team, I'm going to put you to work, you know.
Let me ask you this, and I got to get this in.
Yeah.
You have a book, and it's called, It Isn't Difficult If You Know How to Do It.
Yes. So yes, you can succeed. It isn't difficult to know it if you know how to do it.
Yes.
There's a quick story behind that. So my daughter Hannah, she was about 3.5 years old at the time, and we had a nanny, you know, helping take care of her. And Hannah was playing a very busy, fast-moving pace video game. And the nanny was watching her. She goes, Hannah, it looks very difficult to do. Is it difficult to do it? She goes, it isn't difficult to do it if you know how to do it.
That's what she said.
That's what she said.
Yeah.
And that's a very profound statement
Yes.
for a 3.5-year-old. It means that if you're willing to take advice and guidance from somebody who's already achieved whatever goals that you wish to achieve, if you're willing to learn from your mistakes, the mistakes of others, your success journey will be a lot easier than it would otherwise would be. And so I spent 4 years writing this book to put down in a written form a lot of the lessons I learned during the course of my life, from mistakes I've made, my successes, my coaches, teachers, professors, my parents, my family, my church. And I always say if I had known the contents of what I've contained in that book when I was younger, my success journey would have been a lot easier. I mean, a lot easier, you know.
Yeah. But you made it.
Well, I
for
made
sure.
it, but there are a lot of people who helped me along the way. You know, a lot of people will encounter challenges that they cannot overcome, and that book will help you anticipate a lot of challenges that you need to be aware of, you know, on your success journey.
One final question, where
Yes.
can you get the book?
So it's on Amazon, it's on Barnes & Noble, it's in many local bookstores. I have a workbook that goes along with it also.
Excellent.
But I highly recommend it. It's not because I'm trying to sell books, but I believe in the content. I also have dedicated the course of my career here in Cleveland in mentoring students. I've taken tens, if not hundreds, of students on rounds into the OR. I've mentored them and helped them, write recommendations for college, things of that nature.
You're a Jew. You are a Jew, my friend. No doubt about it. Keep up the good work.
Okay.
God bless you, man.
Thanks for having me.
Dr. Charles Modlin, the legend, right here in Northeast Ohio. Thank you once again.
Thank you.
And thank you for joining us. Remember, whatever the mind of man can conceive and believe, with the Lord's help, it can achieve. We'll see you next time.